Good morning, Acton, and welcome to Java with John, hosted by Town Manager John Mangiaratti. Java with John streams every Friday morning at 10 a.m. on ActonTV's YouTube channel. You can also listen live on the radio at 94.9 FM. Tune in weekly for important information from the Town Manager, Health Department, and Council on Aging, as well as a variety of special guests. Residents can contact us with questions or comments at 978-929-6611 or email manager@actonma.gov.
Good morning, everyone. Welcome to the Java with John program. It's January 15th, and it's nice to see you all again this week. We have an excellent panel of speakers that will be talking with you today. I'll just quickly introduce everyone, and then I'll get into some opening remarks. As always, we have Sharon Mercurio, our Council on Aging Director, Heather York, our Nursing Director and Public Health Expert, and Sheryl Ball, our Health Director and the leader of the health team. We have Michele Ellicks from the Department of Registry of Motor Vehicles, and we have Julie Onos, a member of the town's Diversity, Equity, and Inclusivity Commission. So a lot of great conversations we'll be having later, and there's always time for your questions at the end. So please call 978-929-6611 or email manager@actonma.gov. So it's been a very challenging start to the year, 2021. We're at peak pandemic. We've had, I can't even explain what's happening in Washington. And in our own community, we've been shaken from a lot of very disappointing and disruptive incidents related to racism and issues surrounding that. So I guess I'm going to leave the stuff in Washington alone, and I'll just focus on what's happening here. An important thing to bring up is that we had two incidents at Acton Boxborough School Committee meetings in the last month where someone came onto the meeting and said very racially awful things to women of color on the school committee, and the rest of the committee members as well. Those incidences shook the town, and I think we stood up and got behind Kira and Evelyn, who were the women that were attacked that night. And since then, our police department has been expediting the investigation to try to find out who's doing this. I'm very pleased with the work of Chief Burrows and his team. They expedited the process, and I was expecting it to take much longer because a lot of stuff is complicated with internet IPs and all that stuff. But they did a great job, and they found someone, and we're in the process now of holding them accountable. So the good news is that person has been stopped, and we can start the process of healing. I do think there are a lot of conversations that we've had over the last few weeks related to those incidences that were important and will surely need to continue. I also want to mention, many people were probably following that whole thing, and we did a press release earlier this week, but one thing that we didn't really talk about is the person that was doing these Zoom attacks was also trying to get into the Board of Selectmen meeting. I guess it was this Monday. And I just wanted to mention Mark Hald, the Assistant Town Manager, and Matt Frost, who is the IT Director. They figured it out and stopped this person from getting into our meeting. And I just want to mention that because it may not get mentioned otherwise, but I really appreciate their efforts. So, the pandemic, as I mentioned, there's a lot of questions about vaccine and when are we getting it and who's getting it first. And we're going to do our best to walk through that a little bit with everybody this morning. But the message that I want to start out with is that the information that we're sharing as soon as we have it. And right now we're doing first responder vaccinations as part of phase 1. And we're going to announce additional phases as soon as we have the information ready to do so. But why don't I pass it over to Heather with a more specific update on where we are with the pandemic and the cases. Good morning, Heather.
Morning, John. Good morning, everyone. Nice to see you again. So in Acton, currently we have had, since the beginning of the pandemic, 610 positive cases cumulatively. Currently, there's 55 residents under isolation. We've had 525 people recover, and sadly, the fatalities that we know about are 30. So there is some definite increase. As John said, we are in a spike that are even higher than we were in the spring. The state numbers came out yesterday, and Acton is still in the yellow shaded risk area of a 3.98% positivity rate based on the amount of positive cases in the last 14 days, as well as the amount of testing that was done over the last 14 days. So there were a lot of communities that did bump up to the red this week again, but luckily Acton is still in the yellow. I'm hoping that will stay for a while. We've been pretty consistent with that percentage in the last 4 to 5 weeks. So that's encouraging. One of the trends that we're seeing is definitely household transmission. It's either you're spreading it within your own household, or it's households gathering together that are spreading to consecutive households. So just reminders, if you are with anyone outside of your own immediate household, you should be wearing a face covering, you should be social distancing, and you shouldn't be in a large crowd. So the state guidance is still for gatherings, it's 10 residents or under. So that's a good thing to follow. But the face covering and the social distancing is the biggest piece that we really need to continue to do. Sheryl's going to talk a little bit about the state vaccine rollout program, but I did want to mention that even when you do get your vaccine, you still should be wearing a face covering. You still should be social distancing. Even after you receive the second vaccine, that should still be happening. That guidance will not be rolled back immediately because there are so many people to vaccinate, and the vaccine is 95% effective, but there's still that 5% that potentially you could be affected if you are someone with underlying conditions, and also age is a factor, as we all know. Just on a comment for masks, there are, some safety guidelines that I just wanted to mention. So disposable masks, if you're using those surgical masks that you buy at the store, those are not something that you want to clean, whether it's, washing them or Lysoling, spraying them with some kind of disinfectant. Not a good thing to do. One, because you don't want to compromise yourself by putting any kind of disinfectant on this mask. But also it'll break down the masks and it won't be as effective. So those are disposable. Once you use them, you should dispose of them. Cloth face coverings is the better choice because you can wash those frequently. If you have, at least 5 to 7 face coverings, you have one for each day of the week and you can wash them as needed. So I just wanted to mention that. I think that's it for me today. Thank you.
Thank you, Heather, for those updates and information. Sheryl, can you give us some info about vaccines and everything else that you're working on in health?
Sure. Good morning, everybody. So I just want to let you all know that getting our residents vaccinated is our top priority to combat this virus. We understand that the wait time is frustrating, especially as we hear about other states' progress. We follow the Mass Department of Public Health updates in order to have the latest information available to all of you. We have posted the latest information on the town's website and will continue to update it as new information becomes available. There are more subgroups left within phase 1. As John mentioned, we're currently working on the first responders. Then we have some congregate care settings, which include like shelters and corrections. And then next would be the home-based healthcare workers, which would be like personal care attendants. And then finally, we have the home health, non-COVID facing healthcare workers. These 3 subgroups that we still have, well, including the first responders, we have 4. Once we finish those, we'll be into phase 2, which is slated for February. So phase 2 includes individuals with 2 comorbidities, or individuals age 75 or older. And then it also includes a lot of other workers. So grocery workers, utility workers, restaurant workers, early education, so our K through 12 staff and students, and then a ton of employees, sanitation, vaccine development workers, food pantry workers, convenience store workers, all of that. Then we move into adults 65 plus, and then individuals with one comorbidity. So we are fielding a lot of questions from all of you. Please know that we are closely working with the Mass Department of Public Health to ensure that our residents can obtain the vaccine as soon as possible. As I mentioned, we're currently in phase 1, and we have set the dates to vaccinate our first responders, which will be happening next week. Please continue to check our website, actonma.gov, for updates, or the state's website for the latest information for groups that are currently being vaccinated. And you can also see the group you fall in when it's slated for a vaccination. So there's also on the website, which is mass.gov/COVID vaccine. They also have some other sites on there that are going to be mass distribution centers. Right now, we're currently working with the Neshoba Boards of Health to do our vaccination for the first responders, but this website gives you a great idea of the locations of where you'll be able to get vaccinated in addition to what we offer. So right now, when I looked at it, it was the Leominster Hospital, it looked like Marlborough Hospital, as you know, Gillette, which has started today. So just wanted to throw that out there that you can look at that anytime and help follow the progress. And that's all I have. Just please be patient. We are working closely with the state, and we will update you as soon as we have more information. Thank you, and stay safe.
So thank you. So just before we go to Sharon, so Sheryl, just a question that I'm sure we've all received in the last week. If I'm a senior, when can I get vaccinated?
Well, that's slated for, so if you're a senior or 75 plus, that's the beginning subgroup of phase 2. That should take place sometime in February.
Okay, thank you. Speaking of seniors, Sharon Mercurio is our Council on Aging Director who oversees the Senior Center and other senior programs. Sharon, what's new in the Virtual Senior Center this week?
Good morning, John. Thank you. As you know, we're working very closely with ActonTV, so the majority of our regular scheduled programs are on ActonTV, but we're also doing a lot of Zoom programs as well. So this week on Tuesday, the 19th at 2 o'clock, we have a program, The Growing Divide, Society and Politics in the Antebellum America. Excuse me, sorry. On Wednesday, January 20th, we have our own Brian McMullen and Marty Abbott from the assessor's office. They come each year and do a great program talking about real estate taxes, what kind of programs are available for seniors, because they know that's always a concern. People are concerned about how they're going to pay their taxes, and there's really some fabulous programs that the town of Acton has available, and also some state programs that are available. So that'll be January 20th at 1 o'clock. Thursday, the 21st, we have Ask the Lawyer with Kathleen Summers. It's an opportunity for seniors to meet virtually with a lawyer for a 15-minute consultation. And then we won't be filming Java with John next week. John has a conference, so I just wanted to move ahead a little bit. And Tuesday, January 26th at 1 o'clock, we have online safety with the Office of Consumer Affairs that will be happening. So all of our programs, you can register online, send us an email, let us know what you're interested in, and we'll send you the Zoom link. We've been having a lot of complaints from folks that aren't getting the links. And the problem is that it's going into people's spam and junk folders. So just a reminder, the top 3 culprits are Verizon, AOL, and Yahoo. If you use those email servers, please check your spam and your junk mail. Our IT have done all they can on their end, so it's kind of on your end. And we do have some instructions in the newsletter how to move that from your spam or junk folders to your regular folder. And we also have Honor Society students that can help walk you through it as well. aside from all of the programs and wonderful things that we do, we also provide a lot of social services. So if you're struggling, you have some questions, some financial needs, we can help you apply for fuel assistance. There's different food assistance programs you may be eligible for. Once a week, we get frozen meals from Open Table that are available to anybody. They're not need basis. It could be you just don't feel like cooking tonight. So those are available at the senior center. Just let us know. And as Heather mentioned, the disposable masks are disposable. We do have some on hand at the senior center. We also have some cloth masks. So if that's something that you need, please give the COA a call, 978-929-6652, and we can help you out with that. Thanks, John.
Thank you, Sharon. Our next guest is Michele Ellicks, who is an outreach coordinator for the Registry of Motor Vehicles. So, Michele, what's happening at the registry? Is it open?
John. Yeah, lot of things are happening at the registry. So good morning, John, and good morning, everyone. Thank you so much for allowing me to be here. And thank you also to all of you for all the amazing work that you're doing to help us in town stay safe and stay healthy. So we really appreciate it. So as John mentioned, I'm the coordinator, community outreach coordinator at the Registry of Motor Vehicles. And we're really excited, John, to announce that we have senior hours at the Registry of Motor Vehicles. So every Wednesday morning at the registry, we have dedicated hours for our older adults to come in and take care of their registry transactions. Because here in Massachusetts, the law requires in-person license renewals for anyone 75 years old or older. So you must renew your license in person. So with the pandemic, we want to take every measure possible to help our older customers stay safe and stay healthy. So on our website, we list 17 different service centers that offer these senior hours every Wednesday morning. The other news is that the registry has gone to appointment only business, so that no longer can you just show up at the registry and there are not lines anymore. So everything is by appointment only, and you must make an appointment online. Speaking of online, I just want to mention that we have more than 40 different transactions that can be completed online. So that really we want to remind our customers that if they have internet access, to please start online first. The Registry of Motor Vehicles has a portal. Each one of us, who, if we have a driver's license or an ID card, we have a portal, and you can access that portal by visiting mass.gov/myrmv. MYRMV, and that puts you right into your own registry information. It shows your licensing information, your vehicle information. You can check expiration dates, and you can start transactions from that website. So those are the few things we really want to remind folks. All the safety protocols for COVID. Everyone must wear a mask. Everyone must social distance at the registry. We are taking temperatures of everyone who shows up at the registry. So we're really excited about our senior hours, and we really want to encourage folks, if you have any questions at all, please call this dedicated phone number to either make a reservation or to just ask us a question. And that number is area code 857-368-8005. So 857-368-8005.
So there are senior hours at the RMVs, and you have to be how old to use those hours?
Our senior hours are dedicated for folks 75 years old or older. But, you know, we're not going to turn you away if you're pretty close to, you know,
If you're 72, 73, you might be able to get in?
Absolutely. Okay. Yeah, our goal is to keep everyone safe. So
And what are those hours? Is it a certain hour of the day?
It is generally, John, it's from 9 a.m. until about 11 a.m. Each service center is around that time frame, but we'll help folks figure out the time. The blocks are pretty much from 9 a.m. to 11, but go online first and double check each service center.
Because even though there's senior hours, they still have to make an appointment.
You're right. Absolutely. Okay. Yeah. And okay. One last thing, also our AAA office here in Acton serves as a mini registry. So if anyone is a AAA member, they can make an appointment to visit AAA and renew their license or their registration at AAA.
That's right in, is it Acorn Plaza? Is that what it's called?
Nago
Right on the corner of
Plaza.
27 and Great Road?
2A. You got it. Yep, corner 27 and 2A. And they're fantastic.
Great. Thank you for coming in and talking to us about senior hours and other services available online. Sounds like the registry has really changed quickly to adapt to this new environment. It's really nice to hear.
Thank you. We have. Thanks.
Our next guest is Julie Onos. Julie is a member of the Diversity, Equity, Inclusion Commission, a commission that was formed at the end of 2020 by the Board of Selectmen. Julie, good morning. Thanks for joining the program. Tell us, what exactly is the Diversity, Equity, and Inclusion Commission?
Good morning, and thank you for having me. So I think one of the most important things to know about the commission is that we are a committee of volunteers, right? So we're all volunteering our time because we care about Acton, and we are supporting the Board of Selectmen on these issues of diversity, equity, and inclusion. So that means that the board can turn to us for advice on DEI issues. And it also means that, say what it means to me. I was excited that it was being formed because it's a way to structurally within the town government system, but systematically understand where Acton is and then compare that to where we want to be. And then, so what the commission is doing is finding ways to understand that and then bridge the gap between the two.
And when do you meet? Is it meeting online, virtually, obviously, but is it a monthly meeting? When do they usually meet?
We definitely meet at least monthly. For example, we met last night, but we are really eager. One of the things we're working on is surveying the community. And so we're working really hard at creating that survey and making sure that it's, scientifically sound. So right now we're meeting bi-weekly. We meet via Zoom. The meeting dates and the agendas are all posted ahead of time on the Acton town website, so people can sign up there. You can sign up to get alerts of when the meetings are, and we have public comment time periods in the meeting. So it's not just this meeting that nobody can see or understand. Like, people can participate. And another thing I wanted to say is that people can also volunteer to comment and share their stories. You can join in the Zoom call. Everybody is meeting virtually, so can join in the Zoom call and share your experiences. And you can also send an email to DEIC@actonmass.gov or actonma.gov and share that way, or see how you can participate that way.
Yeah, that's great. And so, and also, if people aren't comfortable doing that, going in a meeting or sending an email to a blanket address, they can contact one of you or another member to talk personally, right?
Correct. Definitely. They can send an email, talk on the phone. Definitely.
And I believe all the members, how many members are there on the commission? Is it 9?
It's a 9-member commission. And we also have 2 alternates, just so that we always can have a quorum for doing the business of the commission.
That's great. And so, thank you. And then, so what other things is the commission planning on doing this year in 2021?
So the biggest thing is getting that survey out. And then once it's out, we're going to spend a lot of time just analyzing the results, and we're going to come up with recommendations for the town about what to do. The really good thing about the survey is, I think sometimes people it's really good to collect experiences and people can share their viewpoints. Doing a survey gives us a way to kind of take a step back from that and collect hard data. And then that way our recommendations are really based on what really exists and what we really find. Somebody could miss a problem and then not address it, and somebody could mistakenly think something's a problem, and we spend a lot of time trying to solve it when it wasn't an issue. So that's the bulk of the work. And then the other piece is just being able to be an advocate and a voice for and a space for people to share their experiences. I think it's really important. Like you mentioned, excuse me, supporting Kira and Evelyn. That's something that we have done as well. And just being able to make space for those who might have felt uncomfortable before, but have a really valid perspective or information to share.
Yeah, I mean, I started out the program earlier talking about the incidences, the attacks at the school committee. How did the DIC respond to that, those incidents?
Mm-hmm. Yeah, I think you did a really good job explaining it. For us as a commission, we did release an official statement. It's on the Town of Acton website. But I think most importantly is two things. One is, just like you, condemning any public and the private racist attacks on any members of our community, especially those two women who were targeted. And then just strongly supporting Evelyn and Kira. I think it's really important to say out loud that their pain and injury is real, and that injury extends to the entire community. I think sometimes it's really common to downplay the harm, or sometimes if you've only heard about like one verbal attack, to say, oh, it's not a big deal, or it's just a prank, or, you know, that's like really common in our vernacular. But the point of this type of attack is to humiliate and to dehumanize and to scare all people of color. And when you ignore them, they can escalate, just like you mentioned with this guy or this individual who was doing these attacks. It's not just that he tried one time, right? He continued to try. And then we are fortunate in Acton to have a police department that escalated it and really found him and stopped him. But, you know, we really, as a commission, we just really want to say that it's.
Julie, you froze up there for a moment. Oh, it looks like you're still frozen.
Sorry about that.
That's okay. You're back. You were saying the commission is going to do, and then you went blank.
Okay, for the survey?
Something like that, yeah.
Okay, talking about what the commission is going to do this year. So for this year, the commission is really focused on completing a survey where we are getting feedback from the residents about where we are in terms of these issues: diversity, equity, and inclusion. And the important thing about collecting a survey is getting hard data so that we can really understand where we are now, and then compare that to where we want to be as a community, and make strong and sound recommendations for moving forward. So that's the big piece of the commission's work for this year. And then the I don't want to call it smaller, but a smaller percentage of our time is just on advocating and making space for people to share their experiences and to speak up for and support those who maybe haven't had a voice previously.
Okay. Well, thank you. Actually, there's a term that I heard at a meeting recently, allies. Can you tell us what that means and what individuals can do to be allies, or what being an ally is?
Sure. You know, I think the biggest way to be an ally is listening, right? So when people of color or marginalized people trust you enough to share their pain, to share uncomfortable experiences, you need to listen so that you can hear and understand, and then offer empathy. And where you are able, you could go beyond that empathy to offer hope and help. And then the other thing that people could do as allies is support systemic solutions to eliminate and discourage bias and inequality. So, for example, when the commission comes out with the recommendations, take the time to read them, understand where they came from, and lend your support so that it's not just having to be the lone few bearing the brunt of, kind of spearheading often uncomfortable discussions. I think when we can, sit in a little bit of discomfort and say, okay, I might be discomfort, I might be uncomfortable, but this in comparison to my community members, my friends, my allies' pain, let me move past my discomfort so that we can get to a solution, and solutions benefit the whole community. So again, the biggest thing is listening, and then secondly, supporting solutions when they come out.
Well, I think that's a good, so the number one job of an ally is to listen.
Definitely.
Start with that.
It's a position of trust, right?
Mm-hmm.
Which is really valuable.
Good. Well, I hope we can continue to talk about that and ways that we can be allies. And please, when the survey is ready, please come back and roll it out or introduce it so that we get some good responses from the community. And thank you for joining the program.
Thank you for having me. Yeah.
So we're going to wrap up in a minute, but there was a couple of questions that were sent in during the program. So I just wanted to get to those before we call it a week. Heather, this one I think is for you. There was a question about if there's any data available about what the ages of people are that are of all these positive cases of COVID in town. Do we know that information?
So unfortunately, our state reporting system doesn't have a report that breaks down by age per community. But if you're looking at the state website and watching their interactive dashboard that comes up, the biggest percentage of positive cases every week and pretty consistently for a while has been the ages of 20 to 29. And that's closely followed by the 0 to 19 age group. The 30 to about 59 still covers a lot. That's a pretty high percentage also. The interesting thing is that when from 59 to the 60 to 69 age bracket, it's about a 33% drop in positive cases. And then from into the 70 to 79 bracket, it's actually about a 50% drop from those numbers. And that's pretty consistent to what we're seeing in Acton. We're following a lot of families with young adults that initially may be the positive case, or children in a school system that may have been exposed at a sporting event. That seems to be a particular trend since sports are now inside as opposed to outside during the summer. So there is definitely a big drop for those 70 and over, which is good news. The bad news is the people that are having the biggest issues and ending up being hospitalized are typically anyone, in that 60 age bracket and above, especially 70, 75 and above. Those are the folks that are having difficulty with the virus and sadly are not recovering from it. And there are, a high number of deaths. I think the average age in the last month or so was somewhere around 75 to 78 was the average age of any of the deaths that we've had in Massachusetts. So if, as a senior, if you have family members who are younger, who are going out and about and doing things and not following the guidance, those really are the people that you need to keep socially distanced from. make sure they're wearing a face covering if they are around you. And that's a really hard thing for people to do. It's hard not to see your children, your grandchildren, but for safety's sake, if you are a senior with an underlying condition, you're better to do a Zoom meeting like this than to meet face to face without a mask on.
Thank you, Heather. It's very sobering. And, we've been doing this for 10 months, but we still can't get used to it. But we have to continue to find ways to keep safe from each other and follow all the guidance that people should know by now. And so hopefully they will. And the vaccinations that we talked about earlier will continue to be distributed, and we'll be in a better place soon. So thank you all for listening and watching, and thank you to our guests. Today is actually Martin Luther King's actual birthday, but it's celebrated on Monday as a holiday. So hope you have a thoughtful and restful holiday on Monday, and we will pick up again in 2 weeks with the Java with John program. Thank you all.